Hi guys, it's Dr. Sandra Lee. You guys also know me as Dr. Pimple Popper. Let's talk about acne today. And this is a subject that I get a lot of questions about. All of us at some point in our life has probably had a pimple. So we all kind of know what it's like. You know, even though it's not life-threatening, and this is something I try to remind my patients all the time, acne or bad acne can really hold you back and can really affect how your personality develops. That's our role as a dermatologist, to really help to manage your acne during this time and to make you feel a little more confident about yourself, and also to make sure we try to minimize acne scarring as much as we can. I'm going to try to answer some of the questions that you have asked me on YouTube and on my Instagram. Hopefully I can answer all your questions and I can make you feel better about those bumps that you have on your skin. So what is acne? Essentially, it's just a chronic inflammation of our hair follicles, essentially, or our follicles in our skin. Acne vulgaris is the medical term for acne that we all know, okay? There's all other kinds of acne too, which are much rarer, like gram-negative folliculitis, acne fulminans, acne rosacea, other different specific types of acne, which we really won't go over because they're not really common. I think in general, most of us who are talking about acne are talking about acne vulgaris. And it happens primarily on the face, but it can also happen on other oily areas of your body, like your chest and your back and even your scalp. So those are probably the most common areas, but you can get it anywhere on your body. Acne starts in the pores of our skin, and pores are really composed of a follicle, a hair grows out of there, and then we also have a sebaceous gland, which is actually an oil gland, and it produces oil that essentially lubricates our skin. So people with oily skin have just a lot more natural lubrication. The issue is that this oil can trap skin in these pores, and if there's bacteria present, these microorganisms can kind of create a local infection there, and that's when you get these papules and these pustules, these red bumps that come up. The primary lesion in acne is called the comedo. We also call it the comedone. A comedone are blackheads or whiteheads. The difference between them is a blackhead is an open comedone, meaning that this pore that is packed with keratin, which is skin cells, is open to the surface of the skin. These skin cells are exposed to oxygen and they darken. The difference between that and a whitehead is a closed comedone, meaning that there's a cover over it, it's white colored, and you usually can't see it very well unless you really stretch the skin, but this is white colored because it's not exposed to air, so it's called a closed comedone. Then the next level of severity is